Cool. I'll share my screen. We can get going. Can everyone see that okay?
Yeah, looks good.
Great. So welcome everybody to our first 2025 webinar, Journeys into Clinical Psychology from the King's College Increasing Access Aspiring Psychology stream. I'm going to jump straight into it because we've quite a lot on the agenda today. So this is kind of a rough idea of like the agenda. So just doing a brief introduction to the event, which I'll go through quite quickly. We have 5 panelists today who are going to go through their own journey into clinical psychology. That'll hopefully take us up to kind of latest 7:20. And then we'll have some time for some Q&A at the end. So we'll pull from the questions that were brought through from our survey. But we'll also use that. So in terms of who are we? So I can introduce myself first. So I'm Nathan. I'm a first-year trainee clinical psychologist from King's. Molly, do you want to go next?
Yes, hi everyone. My name's Molly. I'm a second year trainee also at King's.
And hi everyone, I'm Sheneka, first year trainee at King's as well.
Cool. So we are the Increasing Access Committee at King's, the Aspiring Psychology stream. So in terms of who are we? So you might have seen previous events run by our stream before. So we've taken over the new leads and we slightly refined our mission statement for the year. So our mission statement is we're dedicated to increasing access to clinical psychology training with a particular focus on helping underrepresented groups gain access. So we hope to do this by expanding our outreach to these underrepresented demographics, as well as hosting several workshops, seminars, and reflective spaces for aspiring psychology professionals. In terms of what to expect then for 2025, so we will be hosting various events and webinars throughout 2025. So we have a few already kind of planned. The next one coming up will hopefully be around March time for DCLIN interviews. To hear about these events, the best way to do that is through our mailing list, which we'll post in the chat. So either Molly or Sheneka, if one of you guys can post it in the chat. I'm sure most of you would have heard about this event through our mailing list, but that's really the best way to find links to register for upcoming events. Another thing just to say, because we have events throughout the year, for example, on the interview skills, we want to just keep this event today focus on journey clinical psychology. So any questions you have about, for example, DCLIN interviews or applications, we'd ask you guys to postpone that for future events. We also like to say that there is recordings of previous events run by the Increasing Access Committee. We just wanted to go through kind of a brief introduction to the event and kind of common paths to clinical training and what you might need and might not need to get to clinical training. So a few common ones here, which I think is actually taken from the Clearinghouse website. So you don't need to have an assistant psychology post before you apply. I think this is quite a common misconception, particularly with the kind of new psychology pathways that's been developed over the recent years, especially around London and the UK. There's definitely not a need to have an assistant psychology post. The next one is you need to have years and years of clinical and research experience. I know lots of people have gone straight from master's courses or PhD courses, or else just gotten a lot of clinical, a lot of research, or even kind of a minimal in both. You really don't need to be stacking up years of research or clinical experience before you apply. Next one, you need a publication before you apply. That's certainly not the case. I know loads of people who haven't had a publication or haven't even much research experience at all. It's definitely not needed. PhD and a master's, again, that's not an exclusion criteria. You definitely don't need to have either. Again, it's just how strong your profile is in different areas. And the last one, you need a reference from a clinical psychologist for the DCLIN application form. Lots of people get different references from different places. So it's definitely not something, if you don't have, you shouldn't apply. So those are just some examples. Hopefully when the panelists kind of go through their journeys, you might kind of see some misconceptions that of different paths in, and that's what we're trying to aim for today. Before we get into the panelists as well, we just wanted to talk a bit about the core competencies of clinical psychologists. The reason why we show this here, which is actually from the BPS website, is that there's a wide range of competencies that psychologists, I guess, touch on in their role. And if we go through it, like from all the way from assessment down to leadership, there's so many different roles within clinical psychology that can actually get you these experiences, whether that's a research assistant, whether that's an assistant psychologist, or any sort of voluntary positions. So there's so many different roles that you can actually develop in these competencies to apply for training. And as long as you're touching on some of these competencies, you can definitely reflect on that when you're applying for jobs and when you're applying for the DCLIN Psy. And I guess to note as well, no one is expected to have all of these competencies or to have any of them like really proficient. It's just that you can touch on any of these when you're kind of applying for jobs and going forward. So these core competencies are for qualified clinical psychologists, not for anyone aspiring. But for someone who is kind of unsure what experience they want to get when they're pursuing the field, these are just some different areas you might want to develop when you're looking for different roles. So that's just some basic intro, kind of some misconceptions and kind of what's involved around becoming a qualified clinical psychologist. I hope that's kind of
I think we may have lost Nathan for a moment.
Yeah, I wasn't sure if it was just my end or.
Me too. Let's see if he pops back in, because he's sharing the slides. But hopefully that was clear in terms of these being something that you can touch on in both in your application, but also as you're looking for different roles and the types of experiences that you may want to have. Once Nathan gets back, if we can reshare the screen, then we're going to jump into hearing from our panelists who are going to tell us a little bit about their journeys into clinical psychology. I'll see if I can share my screen instead. But these are just some examples. There's many different routes in. So we have kind of 5 examples from people. They'll each speak for about 5 to 10 minutes. We lost you for a second, Nathan, so I can share my screen and take over from you, and hopefully that improves the connection. Can you all see my screen now?
Yep, it looks good.
Okay, great. So we'll start off with Sheneka's journey.
Yeah, thanks, Molly. So hi, everyone. Good evening. My name's Sheneka. As said earlier, I'm a first-year trainee at King's. And I'm going to talk through a bit about my journey, particularly because I didn't go down the route of a master's or research assistant. So I knew from pretty early on during sixth form, where I initially studied psychology, that I wanted to get into the field, and I wanted to be in a role that I felt was fulfilling and had a positive impact. So I studied psychology further at undergraduate level with a year abroad, and my undergraduate degree gave me the good level of foundation, I guess, for the theory and a lot of research experience, which I continue to draw upon in interviews after graduating. But I knew probably it wasn't until second year that's when I came to awareness of the steps to become actually fully qualified clinical psychologist. So at the time when I was doing the research, I saw a lot about, you know, having a master's and maybe having publications and things like that. And at that stage, I wasn't too keen on doing a master's. So I kind of told myself that I'm going to make sure to try at least for a year after graduating, getting as much paid work experience as possible in the field. And then if that doesn't work, then I'll go and do a master's. So having that kind of plan in mind, I sought out opportunities whilst I was at university to help get the foot in the door. So that was suicide awareness training, any sort of peer support volunteer work where you get to do one-to-one, even with other students, to get the sort of baseline competencies of empathy skills, active listening, or any sort of leadership skills. And when I'd finished university in my undergrad, my first job was in events, so hospitality as a team leader. And this is the, I guess, approach that I took because I became really aware of the financial barriers getting into clinical psychology, particularly around the entry level roles being quite low paid. So with being an events host, team leader, especially it being a 0-hour contract, it gave me the flexibility of still going to interviews, staying on top of applications, but also having an income at the same time. And when I think it's important to note that when you are in roles that may not appear directly relevant, try to get as much transferable skills as possible. So for example, leadership skills, is there any opportunities to supervise somebody else or run an event within the team, whatever, I guess, organization you're working in. And I found that helpful to reflect back on in further interviews, particularly organization skills, communication skills. So it's important to think about those outside of clinical skills as well. So whilst I was doing that, I was doing a lot of applications, and then I stumbled across the Aspiring Clinical Psychologist scheme, which is what gave me my first assistant psychologist job. And that was a 4-month part-time role, particularly for those underrepresented in clinical psychology to help get the foot in the door. So I would 100% recommend to look at different trusts if they offer any sort of schemes, if that applies to you, to help get your foot in the door if you're struggling to get clinical experience. So within that role, not only was I able to be exposed to the work that clinical psychologists do, I was able to sort of build a sort of network of people also trying to get into the field and have a mentor that was already in a full-time, for example, assistant psychologist role. After that, I actually struggled quite a bit to get a full-time AP role. Sorry, my thing got blocked. Yeah, I actually struggled quite a bit to get a full-time AP role. So I kind of tried to cast my net as wide as possible. So I started to look at charity organizations, and that's when I became a mental health mentor for a charity, also part-time. So as I said, I was still kind of doing the hospitality work in the background to sort of manage the financial aspect of things. And that gave me a lot of experience working with different age groups and sort of low-level CBT. So my point here is definitely if you were struggling to get in AP roles, for example, within the NHS, to try and look at different sorts of organisations that might offer similar sort of experiences working with people and supporting people where they can with well-being, for example. Following that, I worked in admin in NHS as a bank position for a few months. And I found that really helpful because it gave me an understanding of NHS systems, which is certainly key when you're going into clinical psychology. You're managing sensitive data, you're working with different range of professionals, and it also gives you access to certain trainings that the NHS provide, like safeguarding trainings that you can book onto and things like that. So sometimes, even if you're struggling to get a direct clinical role within psychology, sometimes roles within the NHS can provide you with useful sort of training that can still help you at least expand your knowledge. So after, months and months of part-time work, I ended up getting my first full-time assistant psychologist role, particularly working in personality disorders. So that's where I became familiar with DBT, CBT, and doing group therapy, individual sessions, and working with MDTs, which is what I got, from all my assistant psychologist jobs, looking back. And as you can see, most of my experience was clinical, and I was quite conscious about not having, a master's or much research background. So what I tried to do in these clinical roles was to make sure I could pull upon skills that would be necessary within research as much as possible. So opportunities for clinical audits and presenting them to get the sort of dissemination experience, collecting any kind of outcome measures where you can. So for example, in most NHS trusts, they routinely take outcome measures or reviews of some sort or questionnaires. So really taking the initiative to ask to do that where you can. And what I found really helpful in my assistant psychologist clinical role, my first one, was liaising with the research and development team within that trust. And when I spoke to them, they kind of gave me ideas of what I can do within the service I was working in and what trainings they have available. So they had training such as qualitative data management and things like that. So try to, I guess, pull on different people within the trust. If it seems within your role, you may not be getting that much research experience. And sometimes within the trust, in the research development departments, they might have research going that you can offer to do some of the time to help with recruitment, for example. And finally, when it comes to leadership within these roles, what I did was, aside from kind of facilitating groups, also offer to chair some of the meetings. If you have routinely meetings like MDTs, or where I worked, it was a DBT service. So consult meetings, trying to offer to chair some part of it or present within a team meeting as much as you can to get some of that leadership. And that worked out for me. In total, it came up to around, I think, 2 years of experience post my undergraduate degree, and it worked out in my favour without a master's. So I hope that was helpful for anyone in the chat on the call today. But of course, I'll be here for the Q&A, so any further questions about that, I'm happy to go through.
Thanks, Sheneka. And there are a couple of questions in the chat for you, I think, if you're able to look over there. But as she said, we'll be doing the Q&A later. And for those questions, if you could put it in the Q&A part, I know it's a bit confusing with Q&A and chat, that would be really helpful for us to just moderate a bit easier. All right, great. And next we'll go to Megan.
Hi everyone, it's really nice to be here talking to you all. Okay, so I am a first year trainee as well at King's. So I started off my psychology journey, as I'm sure many of you have. I did my undergrad in psychology at the University of Birmingham. Whilst I was doing my psychology degree, I really didn't know what I wanted to do. And so I didn't really pursue many extra sort of curricular opportunities or volunteering during most of my undergrad, just as I didn't really know what I wanted to do after studying. But at the end of my 3 years, once I'd graduated, I went on a 5-week volunteering program in Sri Lanka with an organisation called SLV Global, and the aim of that was to promote positive mental health and bolster already existing community projects within Sri Lanka. After undergrad, I took about 6 months off and worked in hospitality. Again, was kind of figuring out what I wanted to do. I knew I really wanted to work with people, and I had really enjoyed my degree, but I didn't really know where I wanted to go until I came across a charity called Resources for Autism. I'm sorry, we'll probably be jumping around my slide a bit because I did a bit of work and then a bit of study and a bit of work and a bit of study. So I hope it's not too confusing. So I started working there in 2019, and I was there for 3 years in a number of different roles. I think as I was looking at the common misconceptions that Nathan shared, I could really see a lot of the ones that I used to hold for myself. So as you can see, I've never held an assistant psychologist post, and yeah, spent most of my time working in the charity sector in a number of roles. So I was a play worker in one-to-one settings and group settings, community support worker, so going into people's homes and into the community. I was a team leader. We used to run clubs in the evenings, on weekends, and during the school holidays. And this, I think, was a really great charity to work for many reasons, but I worked across the lifespan, which I think is something that's really helpful as you're going into your journey of beginning to train as a clinical psychologist, because a lot of the training involves us working across the lifespan, and it was with families, children, adults, older adults, all who were autistic and had many other sort of co-occurring needs and presentations. Towards the end of my time at RFA, I also supported piloting a program with Barnet Early Help Service. So I was an intensive support practitioner delivering a kind of parenting intervention alongside Barnet's Early Help team. And whilst I was there, I decided to go back and do a bit of studying again. So I did my master's in child and adolescent mental health in 2020. So that was completely online because of COVID. And I think that was something that I found really helpful in learning quite a lot about things like formulation, how NHS systems and services work, as I'd never really explored how it works before. I think that was then that I also began to do a lot of research into journeys into clinical psychology. I think that was where my interest was sort of peaked as I was being lectured by clinical psychologists. And it was there that I started to discover all the different roles there were within psychology that I don't think I'd ever even come across before. Definitely not during my undergrad. I don't ever remember anyone talking about, children's wellbeing practitioner posts, psychological wellbeing practitioner posts, educational practitioner posts. But I remember even on my master's, lots of the people that were on it were already assistant psychologists, or the end goal was to become an assistant psychologist, and it just felt like this gold dust that was so hard to attain. So I decided to go down a slightly different route, and instead completed a postgraduate diploma, which is set up in a kind of similar way to the way that you train on the course. So you spend time on placement and time at uni studying, but it's very practical and very clinical. So I went on the autism and learning disabilities pathway and trained in delivering adapted therapies for autistic children and young people. And I did my placement in my first NHS role. So this was in a service that was a specialist therapeutic school. So I was there for my placement year, and then worked there for 1.5 years afterwards as an autism and learning disabilities practitioner, which is where I was up until joining the course. And while I was there, my role involved a number of different things. So there was delivering adapted therapeutic interventions to some of our autistic children and young people, running groups, working with the wider team to reflect on the sort of difficult situations that working in a service like that brought up. A lot of our young people had experienced a fair bit of trauma in their lives, and that can be quite emotional work. I think this was a role where I really began to think about reflection and reflexivity, which I think are really important parts to think about as you're going on your clinical psychology journey. I think something I learned as I was going through the process of applying and interviewing and everything was that it's not so much about what it is you've done, but the sense you make of it and how it's, you know, supported your development and what you've learned from it. So I think that reflection is really, really key. Another one of the misconceptions I noticed from the board was about your referees needing to be psychologists. Only one of mine was a psychologist. It was my master's supervisor. The other one was a systemic family practitioner. Before the course, I'd never been supervised clinically by a clinical psychologist. As it says there, I was supervised by a range of professionals from all different disciplines and backgrounds. And actually, I think that only enriched my learning and my development. And similarly, I really didn't have much research experience before coming onto the course. I completed my dissertation as part of my master's and a service-related project as part of my postgrad diploma, but I've got no publications. My name's not out there. And similarly to Sheneka, I think I managed to find opportunities within my clinical roles where you can get involved in things like audit and outcome measures and things like that, which opportunities you almost have to create for yourselves. I will stop rambling now and give space to the other wonderful journeys. But yeah, look forward to hearing any questions.
Thanks so much, Megan. Right, next we'll hear about Mariam's journey into clinical psychology.
Hi everyone, my name's Mariam and I'm in my first year of the Declan. And yeah, it's so nice to see so many of you, and also so nice to hear from some of my co-trainees and their journeys that I didn't really know so much about before today. So yeah, I'm gonna do my best to do a bit of a quick summary of my journey. And it begins quite similarly in terms of doing a BPS accredited psychology degree. And so I did that with a placement year. And I chose a university that offered placement year, sort of strategically trying to think about how sometimes it can be difficult to access some of these assistant psychology posts. And in my mind, it made sense at the time to go for a university that sort of allowed for there to be a transition into getting experience in one of those posts that was kind of inbuilt. And so I have a few maybe reflections on that experience in terms of like pros and cons. I guess a pro is one that I've mentioned in terms of sort of having a step in the door already. So you're sort of guaranteed to be able to get a placement and get some opportunity and experience from that. But they're often times, and not very similar to other universities that offer placement years, unpaid. So that was a year of unpaid work during the pandemic. And that was a bit of a, I think, struggle in retrospect in terms of how I chose to navigate my journey. So that there's sort of pros and cons to that. But what did thankfully happen after that was that when I graduated, the place that I did my placement year in, which was UCL / Great Ormond Street Hospital, offered me a job to return after I finished from university. So that was helpful in the sense that I wasn't in the same sort of search post-graduation, but then there was sort of the financial consideration of not being paid for the year. But yeah, in terms of what that role looked like, I was part of a randomized control trial. It was a study trying to see whether CBT specifically adapted for children with epilepsy was efficacious. And it ran through the linked children's hospital. And my role as a placement student was an honorary research assistant. And so that involved recruiting people into the study, talking with children, talking with parents, doing extended sort of assessments to determine whether they were eligible to take part in the study or not, and also following up. So things that, I guess, clinical experiences that I got from that predominantly research role, included having discussions about risk, discussions about safeguarding, and also just being exposed to the assistant psychologist and clinical leads in the team, having sort of clinically informed discussions about how to deliver the support and adaptations to make, and all of these different challenges. So I really enjoyed that experience because it kind of gave me quite a lot of exposure being in a clinical trial setting, in terms of being able to build up some research skills, as well as getting exposure to clinical as much as I was able to partake at the time, being an undergrad student. Then I returned to university for my final year, and we had I'm trying to remember what it was called, research studentship. And I think this was also unpaid, but it only involved 2 hours of work a week. So that was much more manageable. And I joined something called the Life Map Lab at King's, and they were investigating adversity in adolescence. And so through that, I was doing some thematic analysis work, some joint sort of partnership work with Bernardo's charity, able to get involved with some publications, and then went on to become a co-applicant for a grant that we applied for, as a young person lived experience advisor. And so I've still got connections to that team to this day, and I'm very sort of grateful and appreciative to them. And I think that was a voluntary experience that you might also be able to find at your universities, in terms of, you know, joining research labs that might have a particular subject of interest to you, and seeing what sort of experiences that they can offer to supplement things that you feel like you might lack in, or that you're worried about not being able to access outside of university. So I've also put in here some what seem to be random other jobs and volunteering positions, but I'll sort of talk about them briefly anyway. With regards to the tea round at the hospital, and my primary school assistant sort of volunteering days, that was during sixth form. And that's actually some of the experience, as well as being a summer camp mentor for teenagers, that I brought to my interview for the placement year. And I guess what I'm trying to say with that is that any exposure that you can get to clinical settings that doesn't directly have to be clinically related, just people related, can really help in demonstrating some of the skills that are really valuable when it comes to thinking about extending to the doctorate application and assistant, or any other positions and beyond. And the one that always sticks out to me is the summer camp mentor. I really loved this job. I would do it during the summer in my breaks from university. And again, a lot of safeguarding, a lot of dealing with risk, a lot of challenging, you know, situations would arise. But it really helped shape my abilities and sort of confidence going forward into like purely clinical roles, which is what I did. If we move sort of to my pre-training work experience, I then transitioned from my research assistant role at UCL to a clinical assistant psychologist role. And that's because the team had a pot of money that they wanted to dedicate to doing a service evaluation project, looking again at whether low intensity CBT would be efficacious for a children with cancer population at GOSH. So this was sort of informed by previous research studies that showed that low intensity support can be helpful for those with chronic conditions, and whether there's sort of a gap that exists in order to serve the needs of children post-cancer treatment with similar strategies. And so, yeah, that was sort of a brilliant role in terms of demonstrating leadership skills before we began it as an implementation project. I did a bunch of interviews with people that worked in the cancer department, then ran this as a qualitative analysis, and the outcomes of that then informed how we went about implementing the project, but also led to writing a paper to then go on and publish. So that was really helpful, and it was sort of a scaffolding process where at the very beginning of that role I didn't really know where I'd get to, but by maintaining really good links with my supervisors and in research, I was able to access or potentially create other opportunities that helped me identify like which skills do I feel like I am requiring more so in order to be able to feel better positioned to apply, because I applied to the course the first year that I got out of university, wasn't successful, and then applied the second year, but more in a mindset of, okay, what type of skills do I want to develop between now and next application to have a better chance. So yeah, I have no sense of the time and how long I've been talking. So please do let me know, give me a signal if I need to press on.
Yeah, maybe about 1 more minute if you're able to wrap up.
Thank you. Yeah, so the final things I wanted to just mention was that while doing those roles in preparation for the course, I thought it was also really important to keep like access to things that were really important to me, and one of those were volunteering in a community cafe for refugees. And I think this awareness of like third sector / charity projects is also a really valuable skill, and just in terms of thinking of wider experience can be quite helpful to engage with. And then now I'm in my sort of finished my first term of the course, and had my adult placement in the dental psychology service, which I love. And it's bringing me a lot of opportunities and I'm enjoying it. So that's where I'm at.
Thanks, Mariam. Right, so next one we're very lucky to have a couple of qualified psychologists join us today. So I'm very pleased to next ask for Lauren to present her journeys, if this will go to the next slide. Great. Lauren, over to you.
Lovely, thank you. It's a bit of a big slide, so apologies. So my name's Lauren, and I'm a qualified clinical psychologist. I did my bachelor's in psychology at the University of Lincoln back in 2011, and I finished in 2014, and I got a 2-1. It's kind of middle to high 2-1. During this time, mainly to kind of help my own well-being, really, I didn't take on any part-time work when I was there, other than my university at the time were developing a sleep lab within the psychology department, and I was lucky enough to have the lead of that as my tutor, and I asked him about whether there were any opportunities to have some work experience, and he kind of took me on as an honorary RA. So during this post, I was kind of helping him to develop kind of new projects, learn a lot about how a sleep lab works and how sleep psychology works, and ended up doing a sleep project for my dissertation. So I did a quantitative dissertation in the area of sleep, which was really, really interesting. I got quite into research during this time. I knew that I wanted to become a clinical psychologist, but I didn't really know much about how. When I was at college, they didn't really tell us anything about it. So I thought I'd go and do a bit more learning, and I do love learning. So I went off to uni again, this time in London, to do the Masters in Psychiatric Research at King's. I did this not because, I wanted it as a stepping stone, so to speak, to get onto training, but because I love learning, and it was a course that had lots of different kind of elective opportunities, and I wanted to, get a bit more of a sense of that before I looked a bit further at training. While doing this, as part of the dissertational thesis that you have to do on the Masters, you obviously have to do a big research project. So as part of this, I latched on to a randomized controlled trial that was going on within King's and into SLAM patients. So the RCT was looking at the effect of electronic cigarettes on the physical health and mental health of patients with psychosis. So I did some work with that and did some honorary work with them a day a week alongside my master's, which, you know, although it's full time, realistically, you know, with the lectures and things, it doesn't end up being full time. So I spent a day a week with them. And that was absolutely fantastic. I learned a lot about research design, how NHS services were kind of built up and funded, and it helped me to learn a lot about recruitment, research recruitment as well. From this, I was able to get a job as a research worker because a vacancy became free. So I worked on that trial for just over 2 years, finished my dissertation or my thesis for my master's while I was doing the job full time, which I wouldn't necessarily recommend to anyone else. It was very, very hard work, but it's just the way that it worked in terms of, yeah, when the vacancy was available. So I did the research work for a couple of years, again, recruiting patients with psychosis across South London and Maudsley community teams, worked with lots of different team members, learned lots of different skills, mostly in research. I wrote some publications from that, which we got published, did some conference presentations, more locally and also internationally. I was very lucky to go to Italy to present. Did lots of data collection and data analysis. So I did a lot of the statistical analysis and interpretation, and also worked a lot with the teams kind of to try and get as many participants as we could. I then moved on to become a research assistant in another trust in East London, where again I was kind of recruiting mostly for research projects. At the time I was looking potentially at AP posts, but financially I couldn't really afford to do AP work. Research assistants were paid more, and I think that is still the case, and I couldn't afford to take an AP post, and the ones that I was applying to, I unfortunately did not get selected for interview. So the research route was much more effective for me. I worked at East London University for a year, and then moved within the same service, but I then started working for the NHS kind of side of East London instead, in the same office, and I worked as a clinical studies officer, where I recruited patients from all kinds of populations, children, adults, older adults, and learning disability, for various different clinical trials and research projects, qualitative and quantitative. This gave me a lot of really, really good experience, again, in terms of understanding how services work, interacting and communicating with lots of different people of all kinds of different levels, patients through to kind of management roles. I, as part of this, though, obviously knowing that I wanted to become a clinical psychologist, it was really, really important to me to develop my clinical skills, which I hadn't had a chance to do yet. So obviously, as part of any role, you are encouraged to try to develop your skills. And as part of my continuing professional development, I spoke to my manager, and they agreed that it would be, you know, beneficial for me in terms of, you know, kind of workplace morale, I guess, to develop skills in this area. We had a local mental health hospital, so she gave me permission that, you know, if I spoke to the hospital and they were happy for me to help them for a few hours a week as part of my contract, so not as extra unpaid work, then she would give me permission to do that. So I reached out to one of the clinical psychologists on the ward locally, and previously he'd had some people do a similar thing, and they were doing some CBT skills groups. So for a few hours a week, I went along, recruited patients to take part in the CBT group, helped develop materials, resources, and then co-delivered the group. As part of this, we had monthly group supervision from the other people who are helping with the group. So that's kind of an informal honorary AP role, and I managed to kind of integrate that into my current work, which was really, really helpful, because again, I couldn't really afford to spend much time outside of my working hours to do that. So eventually, after quite a few years of trying to get on the doctorate, as you can see, I've probably had kind of maybe 5 or 6 years post masters of experience, I got into training at King's. You'll see here kind of some of the examples of placements that I had. I went quite health kind of related, and that's partly my choice. In the 3rd year, you get to choose what placements you do. And so I chose to kind of stick with the health stuff, but there's a massive, massive range of different placements that you can go on. And now I'm qualified as of 2023. I'm currently doing a preceptorship at the Norwich Hospital. So that means that in a couple of months, I'll move up to 8A, because I would have met the competencies to be qualified at an 8A position. And I'm also an honorary fellow at the UEA medical school, where they teach the Deakin and Sci equivalent there. So I do lots of teaching and things like that. But yeah, I guess kind of general advice is, whatever role that you're in, I would recommend thinking about what opportunities you can do in terms of what research you can do, whether that's a clinical or non-clinical role. Most supervisors and line managers have got data somewhere, whether that's outcome measures or waiting times or demographics of the people that you're working with. So there's often data there, and you can use it. So have a word with your managers about what you can do, and think outside of the box. I think that's the best advice. Try to grab hold of any opportunity that you have. Ask around. It never hurts to ask, like I did with trying to get my my honorary work at the hospital. So yes, that's a bit about me, very briefly, and I'll be around for the Q&A as well.
Thanks so much, Lauren. And now we have another kind of qualified staff member, another Lauren, just by coincidence, to share her journey into clinical psychology. Lauren, if you're...
Yeah, I'm here.
Oh, okay, hello.
Okay, so yeah, I'll keep mine super. So I did my name's Lauren. I qualified last year, but I'll get on to that. So I did my undergraduate. I did psychological and behavioral crisis, and that was a course that allowed you to pick modules from different kind of years. So you could either go down a much more sort of biological psychology, natural sciences, or from medicine, go down more of a sociology, social anthropology. I went much more down sociology, social anthropology. So you had your core module, introduction.
Sorry, Lauren, your sound keeps cutting out. I wonder if you're...
Bear with me 20 seconds. I'm just going to get my earphones. That might be better. Bear with me.
Yeah, no problem. She's using an NHS laptop. My NHS laptop microphone also doesn't work. So it's just some of the joys and issues that you may have working for the NHS. While Lauren's getting her slides, you can kind of take a look at some of her experience for yourself. She may not have time to go through everything. And it's really nice to see some examples. Yes, that's
better?
Perfect.
Okay,
yes.
Perfect. So just to really briefly recap, at my undergrad, you could choose to go down more of a sort of biological, medical point of view. So you could borrow your modules from the medicine or natural sciences tripos, or you could go down more of a sociology, social anthropology route and pick modules from there in addition to your kind of core psychology modules. So I went much more down the sociology, social anthropology route. And so my modules were things like, as well as like biological developmental psychology, it was things like race, racism and ethnicity, or things like the social anthropology of disease or the social anthropology of culture, and those sorts of modules as well. And then I volunteered to help with studies around the university. So I helped a PhD student coding for their paper, which was basically they would send me all of these papers to read through, and then I'd have to code according to the criteria that the PhD student had set and then send that back to them. And then later on, I also helped them then with the reviews for that to be published. So they'd had feedback from the reviewers and I was kind of making those edits for them and sending that back. I also helped with studies around the university, like the strange situation study, and that was more just being sort of like either the stooge or doing some of the interviews, but the interviews were very kind of set. I just kind of followed the structure of them. And then my undergraduate dissertation was a thematic analysis on the social representations of addiction. So then I graduated and didn't do a master's. I toyed with the idea of one, but I wanted to get straight into some direct experience. So I worked as a healthcare assistant for 12 months. And that was in an acute crisis ward. So it was for young people aged 18 to 25 who were in an acute mental health crisis. And I worked on a ward. And then after about 6 months, I also applied for an honorary assistant psychologist role. So at the time, I found it really tricky to get any paid AP roles. So I would, see them when I was going into work, and then by sort of like 11 a.m. they'd already gone. So I went on LinkedIn and I've just messaged basically all psychologists in the local area and all clinics in the local area and asked if they were interested in having an honorary AP. And someone responded and said that if I did some sort of admin duties and also did some honorary AP stuff, so delivering sort of manualized interventions, rather than paying me, they would allow me to have fortnightly supervision from a clinical psychologist to have some sort of psychological thinking. Assistant psychologist, it stands for. So have some assistant psychology sort of experience through having supervision. So I would bring cases, or I would bring questions, or I'd bring theories, and we discuss them together. I then got a job as a title called a mental health worker for North East London Foundation Trust, and that was essentially offering CBT for anxiety and depression, emotion regulation work, and leading on anxiety groups, OCD groups. So it was essentially, CBT informed work. And then after 2 years in that role, I got a promotion from a band 5 to a band 6. So it's the same role, but your cases are more clinically complex. So they might also have kind of additional systemic needs, or they might have additional learning needs, or they might also be kind of at higher risk level. But it was the same role, just at a slightly different level of complexity. And that job also paid for me to do a postgraduate certificate in CBT for children and young people. So that was a year-long course where you had teaching for half of it, and then you also had to record all of your therapy sessions, and you were assessed on your ability to meet CBT competencies. You had to complete a portfolio, and you had to do some exams as well. And that's halfway between an undergraduate and a master's, and then the next step would have been to do the diploma. But I then got on to training, so I didn't complete the diploma. So while I was pre-training, I also led the participation groups in my service, but I didn't do anything in terms of kind of extracurricular work at that point. And I had some informal supervision, so supporting new members of staff with like a buddy system and supporting team members that were new to the service, but no formal clinical supervision that I was giving at that time. But I received monthly supervision, but not from a psychologist. Then on training, so I trained at Salaman's, Canterbury, Christchurch, and my first year was a split placement. So that was during COVID. So I was in a CMHT mental health service. So that's a community mental health service working with adults, and that was all online work. And then I had a home treatment team 1 day a week in a hospital. And so that was doing assessments, and if they were referred to home treatment, I would kind of oversee the home treatment team approach. But the CMHT, the Secondary Mental Health Service, that was offering therapy. So I did trauma-focused CBT, and I also did sort of more holistic relationship building work, and I did CBT for OCD as well. In my second year, I had 2 6-month placements. So my first one was a CAM service for children with acquired or traumatic brain injuries. So that was mostly doing neuro assessments, so things like WIPSEs and WACEs, and then writing the neuropsychological reports, but that was also offering some therapy as well. So I did some parenting work, helping parents use a consistent parenting approach, and I also did some anxiety work for people that had had a traumatic brain injury and were kind of working through getting back into their life. And some parenting work for parents coming to terms with the change in role and the change in their child and what that was like and how to manage that as well. And then my second placement was a learning disabilities placement, and that was in a forensic hospital for men with mild learning disabilities. So all of the men had committed some sort of crime. Majority were sexual offences, and because it was usually a year 3 1-year placement, but mine I was put in my year 2 6-month placement, which meant that in terms of the clinical work, a lot of the work is longer term, so you would need a good sort of like 9 to 12 months. So rather than me doing sort of a long-term body of work, I did shorter term pieces. So I did a needle phobia piece of work. I also did a neuropsychological assessment for someone that needed to be assessed whether they belonged in a forensic hospital or would be recalled to prison, and I did a piece of bereavement work with someone who had lost a close family member and couldn't be in contact because of the nature of their offences. So those were smaller pieces of work. And then in my third year, my 6-month placements were an older adult community mental health team. So that was, I did some anxiety work. I also did some compassion focused CBT, and I did dementia assessments and ran groups about coming to terms with dementia for families and carers. And then my specialist placement was in an addiction service, and that was offering mostly trauma therapy, trauma work. And then I've been qualified since October 2023, and I now work in the CAMS National and Specialist DBT service through SLAM, and that's a tier 4 service, so a specialist service that offers the full DBT program to young people and their parents and carers. So that's assessment, once weekly individual therapy, once weekly group therapy, phone coaching, and parent and carer work as well.
Thanks so much, Lauren. It's nice to hear as well kind of some examples of those placements that people might be able to get onto once they get onto training. Great. Thank you so much to all of our panelists and everyone who shared their journey. Hopefully you all found that really helpful. And again, those are just some of the pathways. There are lots of different people who have different backgrounds. You can see some of the variety of people coming from more clinical and more research backgrounds just in our panelists here. But next we'll jump to the Q&A. So we have some questions already in the chat, but please do post more. And if you see a question that matches something that you want to ask, please upvote it, and we'll try and kind of answer the ones that seem relevant to the most people first. But I think that we did also send a survey around. Many of you might have answered it, asking some of the questions that people have. So I think we'll start with a couple of those before we go to the Q&A, just to give you all a chance to look through, ask your questions, upvote, make sure we make this as relevant to you as possible. So this will be for all the panelists. So feel free to just kind of jump in and chime in with advice for all of our aspiring psychologists here. Oh gosh, the very first thing that I want to say, which I totally forgot, is we asked everyone in those surveys what barriers people experienced. And here you can see that we had some from aspiring psychologists, and then we also had one survey that was sent to current trainees or qualified psychologists. The number of people who responded is very different, but what I really wanted you all to take away from this slide is just to say that a lot of these barriers and issues that people have a lot of people share. So you're really not alone in worrying about the clinical experience, the research experience. A lot of people feeling that imposter syndrome, and many of us still feeling that way, even on training and potentially even qualified as well. So yeah, you're not alone in this, and I hope that that doesn't stop you all from continuing to apply and continue to try and access this field. Okay. I'll stop waffling on and we'll get to the questions. So these are some of the questions on surveys. And again, please look at that Q&A and upvote questions that you want answered. But to start, just wanted to ask our panelists, we got a lot of questions about how to access clinical experience. Either how to access AP roles since they are so competitive, but also options for people who aren't able to access AP roles either because they're not paid well enough or just because they're not able to get on. So I'll open it up to you all.
I guess I'll jump in. I spoke about it briefly in my section, but looking for any type of schemes, if it's relevant to you, would be really helpful. And also looking at what would be, I guess, the key skills of an assistant psychologist. So whether it's some of those empathy skills, active listening skills, and then getting those, for example, through charity work, or some charities do, for example, mental health mentoring like I did, or well-being support. And those sort of roles outside of AP roles helped me to then apply for that. I don't know if anyone else has any other suggestions, but that's what I found helpful for me.
Yeah, I have to really agree. And as someone that spent the majority of their sort of, I guess, clinical experience working in charities, I think there is such a wide variety of experiences and job roles to be had out there. And I think, as Sheneka said, if you have an awareness of the kind of skills or even competencies that you want to develop, you can look online at the, the UCL core competencies for a sort of practitioner or psychologist. I think you can really draw on any role that interacts with anyone. And as you know, in the roles that I had working with families, children, adults, older adults, you're working with people with a wide range of presentations, whether that's mental health conditions, physical health conditions, neurodivergence, and actually, in the role of a clinical psychologist, you're often working with people who have gone through a certain number of experiences that mean that they've finally met the criteria to be seeing you as a clinical psychologist. But actually working in the charity sector or roles like that, I think you can develop such an immense amount of empathy and understanding of systems around people, and get much closer to them, and you see them almost earlier in their journey or at different phases of their journey. So I think it's a really valuable experience. I don't know if that helps.
Yeah, I just wanted to quickly add, it's also helpful to try and get adjacent roles. So I talked about being admin staff in the NHS. So you still have to kind of communicate empathy. You're still dealing with very sensitive things, and it's that all those things are still relevant to being an AP. And depending on where you're based, for example, within admin, you could be within a psychological service, for example, or a service that does have psychology there. And that could be an avenue to kind of sit in or talk to some of the people there. So also have a look out for that.
Great, thanks everyone. If no one else has anything to add for this bit, I'll go on to kind of the next more general question that has kept coming up and I think has been asked in this chat also, which is just thinking about how people can gain research experience if they aren't in kind of research assistant roles or haven't been able to do a master's.
I think kind of similar to what I said before, really kind of think about the role that you are in. So for example, if you are in a clinical role, like a very clinical assistant psychologist role or a support worker role, have a word with your manager or those around you about what data they might have, whether that's, you know, psychological data or not. It doesn't necessarily have to be. So for example, I have known people who have looked at, for example, things about DNA rates and whether they're more prevalent in people from certain backgrounds or with certain experiences, or kind of analysing kind of waiting lists potentially, or looking at whether the service is equitable in terms of, you know, who they serve. All of this data is usually around on medical records and on referrals databases, etc. So it's just about all collecting that together, and some of your managers might potentially have data that's already collected that they haven't been able to do anything with. And I know I'm in that position where when you're qualified, sometimes you don't have the time to, you know, do the things that you want to do. So, you know, have a chat with local psychologists or your manager about things that might be available to analyse, you know, quantitatively, but also qualitatively, like feedback. There's so many opportunities. So yeah, whatever role you're in, there's always something there.
I would also say, like, there's something about making your own opportunities in some regard. I think a few people have picked up on how they've managed to do that in a clinical sense, but it could even be reaching back out to people that you're aware of, like university lecturers, and saying, I'm really interested in this research that I can see on your profile, and is there any capacity that you have to take me on for, you know, whatever suits you, I guess, shaping it in a way, because if you're volunteering your time, then you could just suggest an hour, or identifying what it is that you want out of it as well. I joined like aspiring psychologist mentoring scheme. I think there's a few out of different universities. And then that led me to have a contact where we were looking at survey data from trainee psychologists in regards to like equality and diversity and inclusion practices. And then out of that, we did a thematic analysis and then wrote a report to refer back to the uni about how they could potentially change the practices. And that in itself was a way to access research skills, qualitative work, just through identifying or speaking to somebody and saying, oh, I've noticed this and maybe we could do this about it, and seeing where that takes you. So yeah, trying to think a bit outside the box and creating some of those opportunities for yourself as well.
The only thing I'd add as well is that depending on where you guys are, so if a lot of you are King's, the Maudsley is a teaching hospital, and that means that they do loads of research kind of attached to and with King's. And if you kind of move out of London and you're in other places, it's worth checking whether the trust is attached to a university, or whether the trust works very closely with the university, because that would mean they're likely to have loads of different things going on at any one time that you can get involved with to help out. And that research experience can be at any point in the process, right? So don't feel like you have to be at it right from the very sort of inception of the idea or the very beginning. You could jump in at any one part, depending on how far along it is, and still get really involved and still create something really meaningful. So don't feel like you have to be there right at the beginning. You can get there at sort of any point that's useful.
Thank you all. Okay, looking at the Q&A, there are a couple people who have asked how many years it took people to enter the DCLIN. And I don't want to force anyone to share how many times they've applied, but perhaps kind of thinking behind that question, maybe something around kind of how do you keep persevering when it can be so difficult, getting these rejections, and yeah, what your thoughts are on that, advice you would give.
Try not to lose sight of the rest of your life. It took me 6 attempts to get on, so quite a few. And I think, you know, while it was still really difficult, I tried not to put life on hold. So I tried to kind of still see friends and family and have hobbies, and I still got married. I didn't put those things off. Whereas I do, unfortunately, know some people who have put some of those things off, and that's been quite, extra difficult for them. So yeah, try to not lose sight of your life amongst that, because at the end of the day, it is a job. I know it can mean a lot to us, and I know it, obviously, you know, I've been at the other side as well. But yeah, there's a lot more to life as well. So try not to lose sight of that, and I think that can help create some balance.
Yeah, I think for me, holding on to my why of why I wanted to get into psychology helped me along the journey. I'm not going to lie, the rejections was tough, particularly I'm referring to rejections for the AP roles. So yeah, it took me a while in a gap to get another one. And I think at that point, I just decided to try other avenues. And also what I found helpful was to have someone else look at my applications at a point, someone that's not in the field. And that ended up being really helpful for me. So sometimes you need a bit of a breather and kind of reevaluate your processes, holding on to your why and then going back at it. And that's what worked out for me.
I think I really resonate with what Sheneka shared. I think similarly, getting lots of those rejections, especially from the AP post, even though, you know, I did try and apply for one, even though I never ended up working as an AP. And actually, it took me a while to realize that I needed to do a bit of values work within myself and really hold on to and really understand why I wanted to become a clinical psychologist, what was really meaningful to me, who did I want to work with and for, and why, and really think about my own identity and my own experiences. And I think you almost have to do a bit of that work on yourself first, to then keep that motivation, but also just to validate that it is really hard and rejection is really horrible, and it's okay to feel really disappointed, and we shouldn't pretend it's not, because it is.
Okay, thank you all. Okay, we've got another question from the chat or Q&A section. How have you coped with imposter syndrome and maintained a work-life balance on your journeys?
I don't know. I suppose I'm smiling because I feel like, am I still an imposter in this this meeting right now? But that's okay. And I guess that's one way to cope with it, to sort of recognize, I might feel, you know, more or less sort of suited to where I am or what it is I'm doing right now. But giving yourself some grace in that, and recognizing that it's similar to having a good or a bad day. It doesn't really reflect on the whole of who you are and your whole character and everything that you are. It's just that that day was particularly difficult, or that day was particularly good for whatever number of reasons. Similarly, you might feel more or less skilled on a particular day for whatever reason. And so, I mean, it's quite natural. It's quite normal. You might benefit from having discussions with other people in your position and seeing if they feel similarly. That can be quite validating and comforting too. Sorry, I'm not sure that was the most helpful. So if anybody else wants to chip in.
No, I really resonated with what you said, Mariam, and I think it's such an interesting question and really ties into the last one for me, because I remember feeling so ready to start training, and when you get those rejections and you don't get any feedback, or you don't know why or what you did wrong if you hadn't gotten an interview. And same with the AP roles. I wasn't an AP, but I applied for loads, and not knowing like where you've gone wrong. And I remember that frustration of like, what is it? Am I just terrible at this? Like, and I just don't know that I am. And then you get onto training, and what I found was that people came from so many different walks of life with so many different experiences and had done so many different things, that actually it really helped, because I was like, well, maybe we're all imposters, or maybe none of us are actually, because we've all done so many different things, that how can you even begin to compare us? And then you also realize on training that as much as it is, I'm very lucky and it is incredible, that some of it is luck, and actually some of the chance of why you got on this year and not last year isn't because of anything wrong with you or bad with you. Some of it is down to luck, and also it is a job the same as any other job, and that means, exactly as you've said, there'll be good and bad days, but also there'll be parts that you really love about it and parts that you really can't stand about it. And then for me, that's really helped with that imposter syndrome, because it's just helped me connect with the fact that it is the job that I want to do and the job that I love, and it is a job, and that therefore means that I can have a life and friends and go out and do things, because whether I put in 150% effort or 100% effort, I still matter just as much, and that's really important. And I think that's what I tried to hold on to through training and since, is that the rest of you is just as important as the job that you do, and that's what you'd say to anyone else. And you should try and hold that in mind as much as you can. And it's not always that easy when you're like in the depths of coursework and you've also got placement and you've also got all this other stuff going on. But yeah, just trying to hold that you got here and you worked really hard to get here, and there are people that are on this course with you and in this job with you that came from all these different wealth of experience, and all of that matters, and all of that makes you all very qualified to do what you're doing.
Completely agree with all of that, and I've actually learned that the imposter syndrome doesn't necessarily go away even post qualification, and I know my manager, who's a consultant, also feels it as well. So yeah, exactly what Lauren was saying there, you know, a job is a job, so yeah, try to balance it out, find what works for you, and I think that can definitely help, and share that imposter syndrome with others, and actually find that you're not alone.
Thank you, everyone. And I'm looking at the time and I see that we've hit 7:45. I know that there's a lot of questions that we haven't been able to get to, but I hope that you've all found this helpful, to just see a little bit around kind of what journeys people have had getting into clinical psychology, and hopefully some of the advice has been useful. But we are always looking to improve these events, so please do give us feedback. It really helps us to help you, and also to help future aspiring psychologists. So we'll email this around, but please do also scan the QR code and jot down some thoughts. It should only take about 5 minutes. We will also be sending around this recording, but we did also collect some advice from trainees and clinical psychologists on how to address some of the barriers that the people who've completed our survey mentioned facing, that some of you have said in your Q&A in the comments as well. So we will send that round also, so that you can see what other people have said. But a huge thank you to all of our panelists for speaking today and for sharing your thoughts, and to all of you for attending. We will, as Nathan said at the beginning, we will be having other events on about the specific to the application, as well as for the interview. So if you have questions about the application or the interview itself, keep an eye out for when we send registration for those events around. And we do have some videos of past recordings on our YouTube channel, which Nathan has put in the chat, but we'll also send in the email after this. Anything that I've missed, or any final thoughts from moderators or panelists? Great. Thanks, everyone. We'll end the meeting there, and thank you again so much to our panelists for everything that you've shared. We really do appreciate it.
Thanks, everyone.
Thanks, everyone. See you all soon.
Bye.
Thanks, everyone. Bye.
Thanks, bye.